Intestinal dysbiosis is a condition where there is an imbalance in the composition of bacteria inhabiting the gastrointestinal tract. This imbalance can result in a variety of symptoms and health problems, reflecting the importance of the gut microbiota in maintaining overall well-being. One of the main symptoms of intestinal dysbiosis is a change in bowel habits. This can manifest as diarrhea or constipation, often accompanied by abdominal pain. The pain can range from mild to intense and is generally described as a feeling of bloating or pressure in the abdomen. Another common symptom of intestinal dysbiosis is excessive gas and flatulence. This excess can cause discomfort and embarrassment, and is associated with increased gas production by specific bacteria that proliferate at the expense of others. Abdominal bloating is frequently reported by individuals with dysbiosis, and this symptom can be particularly bothersome, affecting quality of life and the ability to perform daily activities. Intestinal dysbiosis can also impact digestion and nutrient absorption. Some individuals may experience poor digestion, leading to symptoms such as nausea, vomiting, and a feeling of heaviness after meals. Poor nutrient absorption can result in nutritional deficiencies, with manifestations such as fatigue, weakness, weight loss, and changes in the skin, hair, and nails. Vitamin deficiencies such as B12 and D can occur, impacting various bodily functions. Mental and emotional health changes are also frequently associated with intestinal dysbiosis. The gut microbiota plays a significant role in gut-brain communication, influencing mood and behavior. Thus, people with dysbiosis may experience symptoms such as anxiety, depression, irritability, and mood swings. These symptoms can be exacerbated by chronic low-grade inflammation that dysbiosis can trigger, affecting the central nervous system. Immune health can also be compromised by intestinal dysbiosis. The microbiota plays a crucial role in modulating the immune system, and an imbalance can lead to an inadequate immune response. This can manifest as increased susceptibility to infections, allergies, and autoimmune diseases. Some individuals may report recurrent infections, such as urinary or respiratory infections, as well as the development of food or seasonal allergies. Skin problems are another possible symptom of intestinal dysbiosis. Conditions like acne, rosacea, eczema, and dermatitis can be exacerbated or triggered by an imbalance in the gut microbiota. Systemic inflammation and compromised intestinal barrier function can lead to increased intestinal permeability, allowing toxins and pathogens to enter the bloodstream and cause inflammation in other parts of the body, including the skin. Additionally, intestinal dysbiosis can cause changes in appetite and food preferences. Some people may have a strong craving for certain types of food, particularly those rich in sugar and fat. This change in appetite may be linked to changes in the composition of the microbiota, which can influence the production of neurotransmitters and appetite-regulating hormones. Intestinal dysbiosis can also be associated with metabolic conditions, such as metabolic syndrome and obesity. The imbalance in the microbiota can affect the regulation of metabolism, influencing how the body processes and stores nutrients. This can lead to weight gain and the development of insulin resistance, increasing the risk of type 2 diabetes and other metabolic complications. Another important symptom of intestinal dysbiosis is chronic fatigue. This symptom can result from chronic inflammation and poor nutrient absorption, affecting energy levels and overall body function. Fatigue can be debilitating, interfering with daily activities and overall well-being, and may be accompanied by concentration and memory difficulties. Additional digestive problems such as acid reflux and irritable bowel syndrome, IBS, are also frequently observed in individuals with intestinal dysbiosis. Acid reflux can cause significant discomfort, with symptoms such as heartburn, chest pain, and difficulty swallowing. IBS in turn is characterized by a combination of abdominal pain, changes in bowel habits, and abdominal distension, all potentially related to microbiota imbalance. Oral health can also be affected by intestinal dysbiosis. There is a bidirectional relationship between oral and gut health, with dysbiosis potentially contributing to conditions such as gingivitis, periodontitis, and bad breath. Systemic inflammation and increased intestinal permeability can affect the oral microbiota and immune response, exacerbating oral health problems. Another important aspect is the impact of intestinal dysbiosis on cardiovascular health. Research suggests that microbiota imbalance can contribute to systemic inflammation and the development of atherosclerosis, increasing the risk of heart disease and strokes. Chronic inflammation and metabolic dysfunction associated with dysbiosis can directly impact cardiovascular health. Hormonal health can also be influenced by intestinal dysbiosis. The microbiota plays a role in the metabolism and regulation of hormones, and imbalance can affect hormone levels. This can result in symptoms such as menstrual irregularities, polycystic ovary syndrome, PCOS, exacerbated menopausal symptoms, and general hormonal imbalances, affecting both reproductive health and overall well-being. Additionally, intestinal dysbiosis can be related to the development of food intolerances and sensitivities. Increased intestinal permeability can allow undigested food particles to enter the bloodstream, triggering adverse immune responses. This can lead to symptoms such as bloating, abdominal pain, diarrhea, and fatigue after consuming certain foods. Bone health can be compromised by intestinal dysbiosis due to poor absorption of nutrients essential for maintaining bone density, such as calcium, vitamin D, and magnesium. Chronic inflammation can also affect bone metabolism, increasing the risk of osteopenia and osteoporosis, especially in older or at-risk individuals. Respiratory problems can also reflect intestinal dysbiosis. There is evidence that gut microbiota can influence respiratory health, with imbalance potentially contributing to conditions such as asthma and chronic bronchitis. Inflammation and immune response modulated by gut microbiota can have distant effects, affecting lung function and respiratory health. Renal health can also be impacted by intestinal dysbiosis. Systemic inflammation and the production of toxins by imbalanced gut bacteria can affect kidney function, increasing the risk of chronic kidney disease. Dysbiosis can influence kidney health in various ways, including modulating blood pressure and chronic inflammation. Mental health, specifically cognitive function, can be compromised by intestinal dysbiosis. Studies indicate that microbiota imbalance can affect memory, learning, and other cognitive functions, possibly due to chronic inflammation and altered neurotransmitter production. This can have a significant impact on quality of life, especially in older populations. Additionally, intestinal dysbiosis can affect drug metabolism. The microbiota plays a role in metabolizing many medications, and imbalance can alter the efficacy and toxicity of pharmacological treatments. This can lead to a need for dosage adjustments and careful monitoring of side effects. Symptoms of intestinal dysbiosis are varied and can affect virtually every system in the body. The complexity of this condition highlights the importance of gut health for overall well-being. Managing symptoms and restoring microbiota balance can involve lifestyle changes, including diet and supplementation, aimed at promoting a healthy and functional microbiota. The manifestations of dysbiosis can be highly individual, with some people experiencing more intense and varied symptoms than others. Recognizing these symptoms and understanding their origin can be crucial for effectively addressing dysbiosis, seeking to restore gut health and improve quality of life. The interaction between gut microbiota and the immune system is an expanding area of research, with significant implications for understanding dysbiosis and its consequences. Modulating the immune response through the restoration of healthy microbiota can be a promising strategy for treating various conditions associated with dysbiosis. Gut health is a critical component of overall health, and dysbiosis represents a significant challenge in this context. Addressing dysbiosis involves a holistic understanding of the impact of microbiota on multiple body systems, and promoting a healthy gut environment can be key to maintaining overall well-being. Diversity of the gut microbiota is crucial for health, and loss of this diversity is associated with dysbiosis. Maintaining a diet rich in fibers, prebiotics, and probiotics can support microbial diversity and help prevent or correct dysbiosis, promoting better gut and overall health. Chronic low-grade inflammation associated with dysbiosis is a key factor in the connection between gut microbiota and various chronic diseases. Reducing inflammation through microbiota modulation can be an effective approach to improving health and preventing associated complications. The role of short-chain fatty acids, SCFAs, produced by healthy microbiota is fundamental for gut health. These compounds have anti-inflammatory properties and contribute to intestinal barrier integrity, helping to prevent dysbiosis and its consequences. Increased intestinal permeability, often referred to as leaky gut, is an important component of dysbiosis. Restoring the intestinal barrier by promoting healthy microbiota can be an effective strategy to reduce symptoms and improve overall health. Symptoms of dysbiosis can be exacerbated by lifestyle factors such as stress, lack of sleep, and poor diet. Addressing these factors can be an essential part of managing dysbiosis and promoting gut health. Supplementing with probiotics can be a useful strategy for restoring healthy microbiota in cases of dysbiosis. Selecting specific strains of probiotics can be targeted to address microbial imbalances and reduce associated symptoms. Fermentation of dietary fibers by healthy gut microbiota produces beneficial compounds that support gut and overall health. Incorporating a variety of fiber sources in the diet can support microbial diversification and help prevent dysbiosis. The impact of dysbiosis on liver function is an area of growing interest, with implications for conditions such as non-alcoholic fatty liver disease, NAFLD. Modulating the microbiota can influence liver health and offer new approaches for managing these conditions. The study of interactions between gut microbiota and the gut-brain axis is revealing new connections between gut health and neurological functions. Dysbiosis can influence mental and cognitive health, highlighting the importance of a healthy microbiota for overall well-being. Intestinal dysbiosis is a complex condition with multiple facets and impacts. Understanding its symptoms and underlying causes is essential for effective management and promoting optimal health. Integrative approaches that consider diet, lifestyle, and supplementation can be key to restoring microbial balance and improving quality of life.